இடத்துல கூட இப்படி வர கூட பறிக்க வச்சு கூட கொண்டுட்டு வருவேன். நம்மளுக்கு தீயரிக்க வேணுமாண்டு நான் எல்லாம் செய்வேன்.
Thank you, Bill Stewart and Larry Brilliant, for organizing this meeting and giving an opportunity to meet all of you here. Now this, what you call the Aravind model, has gradually developed in the last 30 years. In a country where people are poor, big country, where not many doctors at all, how exactly we can create a system to operate a large volume of patients with a good quality care with the resources that we had in our country. As you would have seen there, we didn't have any money at all in the beginning to start with. But the wonderful thing that the community was observing how we were doing it. I remember in the early days before the Aravind started, when I was in the government hospital, we used to go for camps. And thousands and thousands of people with both eyes cataract, mature cataract, they were all complaining, we have not seen the food that we are eating. We are not the children's faces all. Couldn't you give us sight? That was a challenge for us because we had only a few doctors there. Then we used to start operations in the morning, 6 o'clock. By 6 o'clock in the evening, they will say, yes, sir, you have done about 600 cataracts. There are another 100 cataracts. Why don't you finish them also? So the whole motivation was, yes, if we work another 1 hour or 2 hours, we can give sight to another 100 people. They can see their children. They could see what they are eating also. So the primary motive was how exactly we could help more and more people to get their sight back also. And it was a big experience for us because the government gave me $15 for each camp, 750 rupees per camp. I had to feed the patient for 7 days. I had to give them a pair of glasses also. Now how on earth I am going to do that one with 750 rupees also? The community was watching us very carefully. How we were struggling hard, putting all our effort. We had no lunch from morning 6 o'clock, we were working till 6 o'clock. When they could see us, how we were working there, they came with a big response. They said, don't bother about all these things, leave it to us. It was very nice to see the whole community in the village immediately organized. They had a squad for feeding patients. They said, give the rice mills, people give the rice. The vegetable market people will give the vegetables. The oil mill people will give the oil. And the people used to cook and feed 600 patients 7 days a week. The response was so good there, and they would stop it. They said, now you come to my place also and do a camp. So this became a great movement, and I had hardly any trouble of getting money because they are all willing to give us money, though they are poor. Even today we find here, the response for camps is so much. Some of the people who have been working with me in 1961 are still continuing to work with me. Because they see how the community is getting benefited. Old people who cannot move out of their houses are now able to move out of their houses. They can see their children, they can work well also. So this is a thing, they think it is a prime need of the community. And still they are asking us to do more camps also. Now, interestingly enough, this system has become so popular now. We get requests from all the countries, many of the countries in the world. Last month we had a meeting. We had people from Ecuador, Bolivia, Bangladesh, Indonesia. All they say, yes, give us this model so that we can help our people. We don't have money to have big hospitals and do operations by paying the doctors heavily also. So this is where the spirit of service, and it gets enormous amount of sympathy and support from the public also. I come from Pondicherry. You might have all heard where the recent tsunami effect was there. Right, not in Pondicherry, but a few miles up north and 5 miles south, hundreds of houses have been washed away. Children are washed away. The boats were washed away. No fishing nets for them. They were just people and nothing to do with them. But the immediate response came from all over the world. Human nature is so good, in spite of all the terrorism, in spite of all the hatred. There is so much of love and kindness. People all over the world, people came and could support us. What is it? Can you give clothing? Can you give food? Can you give? People from Punjab came and cooked food and gave it to people all. So there is a wealth of love and kindness in the humanity as well. Good. How exactly we can utilize that one to mitigate or minimize the suffering? You all remember that health, especially eye care, is an absolute need also. The life of a man who is blind is almost like a death. So how exactly we can do it also? Interestingly, we had a visitor recently from north part of India. The Sonia Gandhi's son came. He read about the Aravind Eye Hospital, the model which is self-supporting, without any philanthropy, without any grants from the government. We were able to raise enough money from the poor people and provide services to thousands of people also. He wants this model to be replicated in his place also. So also people from Africa come also. So I come to friends here, and the Seva Foundation has been started with the same way. My friend Larry was the one who showed that a disease bad like a smallpox can be eradicated from the world. This is a new concept. If smallpox can be eradicated, why not eradicate needless blindness around the world also? The Seva Foundation has been set up with these people and is doing wonderful work here, and more requests are coming from various parts of the world. They are getting research from Vietnam, Cambodia, some of the African countries. So if we can develop this system very well, so now how am I going to produce hospital management people? How to produce doctors with supporting paramedical workers also? All this can be done if we can create a system, and then problem can be easily solved if we can eradicate smallpox or polio. Why not eradicate needless blindness in the world? But this is a challenge in these days of communication technology, where information is reaching every nook and corner of the world. We are trying our best to create this information technology villages, giving them access to a computer so that they can get all their problems, whether it is agriculture problem, health problem, or education problem, solved by themselves also. India has got a very rich tradition. In a state like ours with 60 million people, you won't imagine 35,000 temples have been built in the last 2,000 years there. Colossal temple. A temple can easily hold about 1 million population there inside. Such a rich culture which has been there, how to revive it back and get into the basic needs of the people, that's the challenge now we're facing today. There are lots of friends here who have helped us. My friend on the left side has started the Institute for Health and Healing. It's a wonderful experiment that he has started now. There's lots of experience from various parts of the world. People have experimented in different ages about various methods of healing. Why not put them together and develop a system where alternative methods of healing also can be involved also. It's a wonderful opportunity now, and there are lots of youngsters here who are willing to put all their efforts. I am sure the two organizations here, Seva Foundation, the Institute of Health and Healing, will grow very rapidly to eradicate not only needless blindness, needless disease also on the earth. We know most of the diseases can be prevented or cured, and it should be possible when you have got institutions developing more and more here. I think I will stop here. If you have any questions, we will answer. Thank you.
As many times as I've seen that film, I cannot see it with a dry eye. And I know Dr. V would be interested, as Larry and I would, to hear from a few of you. I think we have a few moments, and we're an intimate enough group, as to what came up for you around what you saw in that story. And there are no wrong answers and no grade books. Anybody feel like speaking? Yes, please.
Aravind and I are midwives in San Pablo, California. We work with low-income women. We deal with every day, 20 minutes from here, what got Dr. V started in this business. And we both work a lot internationally and dealt with women dying where the children end up in government orphanages and end up being sold. And very, very simple. And to save a woman's life and save a family, the inspiration that got Dr. V started. So we're here talking. Now, how could we take the same sort of model and get efficient, get the administration going? Madeline's applying for public health at UC Berkeley right now to go into administration. I'm writing, and it's an inspiration to see what you've done. Thank you.
Thank you. One of the reasons Dr. V is here is because what he has accomplished transcends ophthalmology. It transcends medical care. It violates every national border on the face of the planet. And it really is about global citizenship and a way of being in the world. Would anyone else?
Having worked in other places besides here, part of the questions I have is, we're such a profit-motivated model here, and it's not altruistic, it's not based on generosity or that we all deserve the same health care. So my question always is, how do you change that model in a system that isn't inherently not that way? And then also, like, my vision of like maternal child health, when I worked in other places, it was all in the same place. So you could have a group of women and children all together that form a bond, that communicate, and they can all be seen at the same time, so that a person doesn't have to make 20 visits for the same care. And in our population, we confront transportation problems. And I'd like to see here a system that's more efficient, where you can combine services and build a community amongst the patients as well as the providers. But it's sort of antithetical to the way things are set up here. So I'm just curious on feedback on making change in a model that is inherently not easy to.
And the best way that we have found out is to you become a model. Whatever you want other people to do, you have to do yourself. When we had 800 operations, 1,000 operations, I will tell the nurses, now we have got 1,000 operations, and they will plan. Yes, sir, we will start at 4 o'clock in the morning. The nurses have to be ready at least 2 hours before the operation starts, you know. They are wonderful. Even now they are doing wonderful work also. And once you get into the operation room, you don't come out for lunch or breakfast or something. So whatever you eat at 6 o'clock has to last till about 6 o'clock in the evening. You can have something to drink in between. Do also. Lastly, it was, so much of dedication was there in the work, because they could see the chief also is doing the same work. And when I finished the work at 6 o'clock in the evening, we used to sit down for a meal. The janitor used to sit by my side. I have to respect him. He has worked so hard. So everybody will sit together and then have a meal. And people are immensely happy, because 1,000 people have been given sight which they could not imagine at all. So there is so much a wealth of love and thankfulness to the work. And this is the energy which is going into our team also, the work. Unless you see those women or men who have had their sight back, how thankful to you. Yeah. They think you are the God, something like that, they say. And this is really the energy that gives up to these people. So here, very interesting to watch here. Normally they say the doctors are mad after money or something like that. Could be, I don't say. But here is a chance when they can see so many people coming to them without sight, and you are able to give them sight for nothing. They are not paid anything at all. And that feeling of happiness in them is the biggest reward that you can think of in the world. Everybody feels it all.
Yes, please.
I honor the work that you've been doing. My name is Barbara Gallion, and I was struck when you asked what hit us in that film. The old adage, the power of one, and just recognizing the growth of what's taken place. And beyond that, when you were talking about if people just worked an extra hour, an extra 2 hours, the fact that people could have sight and see their families and see their fields and see what they were doing. And I live in India half the year. I came tonight with my friend Jan. I work as a management consultant, and half my work is with the United Nations and the other half is with the corporate world. As I was sitting here, my mind was spinning and thinking about what I can take back to India. And I definitely need a copy of this DVD and what I can do with it here, and the importance of just spreading this kind of word. And when I go back to India, with a lot of the corporations that I do work with, a lot of what we talk about is community service, and recognizing how working with your project and taking on something like this would be a wonderful thing to share over there, but also take this DVD here and just the message that the power of one can make such a significant difference And I just feel very honored to have the chance to hear what you're doing and see what you're doing and to be able to be a part of this. So thank you so much, and thank you to all the people that are supporting you as well. It's a wonderful stance of leadership. I appreciate it.
Thank you. Thank you.
I come from a manufacturing background and I'm not a doctor. Doctor, do you have a problem, and I certainly admire what you've done, with burnout of the doctors? I mean, how can they keep this pace day after day? As I say, I'm from a manufacturing background. And I look at this as one of the fine manufacturing products in the world. Now, do you have a burnout problem? I don't know if you don't know what I mean by that term.
Yeah, did you hear him? He's asking how you get so much productivity out of your staff. Do the doctors and the other workers not burn out or stress out?
I think that's a very good question also. I mean, people get tired, I don't deny it. And I remember every week I used to travel 100 miles or 150 miles to go and organize a camp and come back. The physical work was strenuous, but the enormous amount of spiritual energy that you get is tremendous. Well, here you identify yourself with a poor blind woman. She couldn't see you. She looks at you from the voice that comes from that, and he puts her hands, folding hands also. And then in the day of the discharge, she comes to you with tears in her eyes. From her eyes, and she is saying, "You have given me sight." The amount of energy that you get out of it is something which you have to see also. I don't think even getting $1 million or $1 billion rupees will give that reward also. A soul like you, being deprived of the basic need of sight, and when you return that sight to that man or woman, it is wonderful sight that you have to see, and that keeps us going, I think.
Sita.
Dr. Lee, I was wondering, now that in India, heart disease and diabetes and sort of the diseases of the West have really taken over, what do you think this type of model that you have developed with the kind of care that's given and the education that's given, is this something that's you think is transferable into other diseases?
She's asking if the model for managing blindness is transferable to other diseases like diabetes.
It is a very interesting question also. In the early days when we started camps, people were laughing at us. What is it? You were taking medicine to the streets. You lost the sacredness of it. They used to look down on us. He is a camp surgeon. Now you will find out everybody is organizing a camp. The heart surgeon is organizing a camp. The children's camp, the diabetic camps, you will find almost every camp place also. Because the appreciation of the community is so great, they don't want to lose that reward from the community also. So most of the people are now holding camps now. The government also has taken up the idea of a camps, because there's no way of reaching the people. 70% of our people are in the rural areas. They have no money to come to you. So if you go in search of them and they come to you, it is doubly rewarding for them.
Bill, can I make a comment? Oh, of course, of course. There are a couple of lessons that derive, I think, from the Aravind model. There's specific lessons, there's a whole lot of them. But one of them is sustainability, because if the organization is not financially sustainable, then year after year, all the money that can be given to it, brought in,
won't reach a equilibrium, and then everybody will burn out because it will be just constantly fighting against, in the case of Aravind, a backlog of 8 million blind, which is what it was when Dr. V started. But if an organization can be made to be self-reliant, self-sustaining on a business basis, then it can grow and expand. So it's a different concept of development. Everybody, when you start off working in economic development, you go get your master's degree, the first thing you say is, yes, you know, sustainability, but you don't mean it. Because to be sustainable means that the institutions in the West or the developed world will no longer be needed anymore. And there's a tremendous psychological, economical, and political issue around in sustainability. But what's important isn't that Dr. V started off thinking sustainability. He started off thinking the divine will show me the way to rid the world of unnecessary blindness, and sustainability was something that came out of the equation. Also, appropriate technology. When Aravind started, the first surgeries that were done were not done with intraocular lenses. They were done with Coke bottom, big, thick glasses. Villagers would lose the glasses. And there's no difference to a villager from being blind because you have cataract and you're blind, or you have cataract, you were operated, you got glasses, and you lost the glasses and you're blind. Either way, you're blind. So Dr. V pushed the envelope to find ways that this absolutely inappropriate technology called intraocular lenses, inappropriate, $300 each, could be made appropriate by migrating manufacturing to Aravind, by pushing the price point down from $200 to $1. It's interesting that in somebody else's hands, that would be the ultimate capitalist tool. You know, you lower your cost of production and you increase your profit. So these two things that Dr. V did, economics, sustainability, appropriate technology through manufacturing efficiencies, they would be boring. They don't resonate in the same sentence as spiritually driven or divine inspired, but because the emphasis was on how do we help the poor, how do we rid the world of unnecessary blindness, these specific lessons get transformed in hands like Dr. V so that they're tools for the good, not tools for exploitation. I think that's the key. It's the motivation and the intention that you begin with, and then everything else flows from it.
I think it's an important point also, because 30% of our patients are paying. With the money we get from the 30% of the patients, we are able to take care of 70% of the free patients also. The interesting thing is we make a profit of 40% on the investment also. So Harvard Business School came and made a study. And a lot of people have made studies now. The business schools are interested in this program. How on earth you can operate 70% of the people free and 30% only pay, still you make a profit of 40%.
Now that's an ROI, isn't it? Yes, Stella.
Thank you very much. I'm a nurse. I work with people with cancer for many years. And two things struck me about your video. One was the fact that there's so little there. There's so much that we take for granted. And it's just so amazing, you know, in our lifestyles. And I don't know, it's pretty amazing of what we in medicine have become here in America. And I just really applaud you. The second thing is what Dr. Stewart said in the very beginning, which is you must have a quiet mind. And I saw your meditation room, and I'm very curious as to what your group of people do to develop their quiet mind, and what you must be very busy as we are here.
Did you hear that? She wants to know how you teach your people to develop a quiet mind when they're so busy? I think she'd like to know the secret of your quiet mind.
Very interesting question. One of the basic concepts about in yoga or developing yourself to higher levels of consciousness is to try to keep your mind peaceful or quiet. Not easy. It may take 100 years. But you aspire, you ask for it constantly. Suddenly you find a man who is very educated, gets anger. He loses himself. Some of these characters gradually have to be experienced, just as you do physical exercise. Then once you get into the state that you are able to feel the calm and peace, then you develop an equanimity, you are able to face any of these things out. Now gradually at that time you find higher levels of consciousness is helping you come. You are able to find out the right method of doing your work, the right steps you have to take in your step, and then as though a hidden hand is guiding you, the divine force is helping you in this manner. But this is a sort of a practice that has been going on in several places. How to get into the higher levels of consciousness. You always talk about, oh, this man was inspiring, illuminating, oh, there's a revelation. So people are aware of higher levels of consciousness working there. So ask for it and then quieten your mind. Then you will have the experience also.
Well, I want to thank Dr. V and Dr. Brilliant and the Seva Foundation and the IHH and each of you for giving us this opportunity to bring our medicine together and to share a bit of time with Dr. V. And